I'm Howard Nemerov, and I teach my method of neuromuscular therapy. Module 2 has 3 primary goals. Learn why hip muscles are part of core function. Expand your knowledge of physiological functions that produce compensation. And learn how pregnancy impacts core function. Another name for Module 2 could be Welcome to the Bottom of the Core. Looking at the fascial system, there is no clear line separating the core from the hips. This is certainly true functionally. For example, what's called piriformis syndrome is often motor control recruiting piriformis muscles to compensate for abdominal muscles. The pelvic floor is the bottom of the core, blending into the hips via the deep fascial connection of the obturator internus. Because of this direct link, pelvic floor issues can manifest as hip problems. We explore pelvic floor and hip compensation. As we progress, we begin exploring practical applications, like how pregnancy impacts abdominal wall and pelvic floor function. The Nemerov method can speed postpartum recovery. Compensation causes hip problems in other ways. Sometimes low back muscles compensate for hip functions. Sometimes hip muscles compensate for trunk stability and balance. You'll learn how to assess and treat these patterns. Mastering the hip prepares you to succeed in treating the shoulder, the most complex joint in the body. Both joints perform the same basic 6 movements. In this way, each module builds upon the last and prepares you to understand and integrate the next. Understanding core and hip may take you further than you think. Many knee problems begin as core and hip compensation. Shoulder problems often begin as core compensation too. Hope to see you at my next training.